Welcome to my YouTube channel. Myself, Professor Dr. Satish Polchettiwar, a trusted source for pharmaceutical knowledge. Today, we are diving into a vital quality control test, that is sterility testings. Let's discuss and understand the sterility testing of pharmaceuticals, part 1. So sterility testing, why it is important, how it is done, let's explore. So what is learning objective? Today we are discussing on objective of sterility test to understand the purpose and significance. Then we will probably discuss on sample size, method as per official compendium, and finally we'll discuss interpretation of results. That's very important for any subject. So learning objective, by the end of this lecture, you should be able to understand what is sterility and what is sterilization, state the reason why sterility testing is important and necessary. Then we'll understand the various culture media used in perform sterility tests, sample size, object required for sterility tests as per the pharmacopoeias like BP, IP, and USP. Describe method used to achieve sterility and principle upon which they are based. Criteria for methods, that is very important, how we can select the method for particular products, and sterility for various dosage forms. And the state the factor that we have consider when setting up sterilization protocols. That is very important parameter as IPQC parameters. Now the questions come, why sterility test? So this is very important and critical microbiological test performed to ensure that pharmaceutical product, especially injectables, ophthalmic solution, certain medical devices are free from viable contaminating microorganisms. So that's why we need to always check the sterility, because we cannot administer any product which having a contamination. We all know if you administer any contamination product, that may cause detrimental effects to mankind. So that's a very important, you can say, the problems of these parenteral products, that is product recall. Many products getting recalled because of these problems. If you see this chart, microbial contamination, 11% product getting recalled from market because of this. Diagnostic error, more than 6% diagnostic kits are getting recalled from market because of the error which is happening during manufacturing and productions. Failed test also. So lack of sterility assurance, 79%. So that is again one of the major cause of why product getting recalled from markets, because this is very important, we can say, test, because sterile products are directly introduced into body. So any microbial contamination can be life threatening. Hence sterility testing is regulatory requirements under USP, BP, IP. If we just talked about assessment method, assessment of microbial contamination in pharmaceutical products, there are different approaches probably we use in pharmaceutical fields. So one of the tests, that is sterility test. Another is physical chemical changes. So today I'm more focusing on spotting into this sterility test. Then we can assess the microbial contamination from non-sterile products like microbial limit test, like TVC method mostly we use. Estimation of pyrogen, that is also one of the problem in pharma industry during the productions, during the manufacturing. We need to always check the pyrogen, that is nothing but the endotoxin test. Then rapid pyrogen test, that is called RPT, which also called as luminous amoebocyte lysis test, LAL test, which is very popular. Then MAT test also there, which is cell-based test. That is one of the we can say optional test for the this LAL.
Hello everyone. Welcome to Dr. Satish Polchettiwar educational YouTube channel. Today, let us talk about one of the most critical quality control tests in pharmaceuticals, sterility testing. Sterility testing is essential for parenteral products, ophthalmic preparations, and surgical devices to ensure they are free from viable microorganisms. There are two main methods used. First, the membrane filtration method. This is used when the product can be filtered without damaging it. The sample is passed through a 0.45 micron filter, which traps microorganisms. The filter is then incubated in fluid, thioglycollate medium and soybean-casein digest medium for 14 days, under specific conditions. Second, the direct inoculation method. Here, the product is directly added to the culture media. It is simple, but not suitable if the product is viscous or has antimicrobial properties. What about precautions? Sterility testing must be performed in a Class 100 cleanroom or laminar airflow hood by trained personnel under aseptic conditions, Environmental monitoring is a must. How long does it take? A typical sterility test runs for 14 days to allow time for microbial growth. What if contamination is found? If even one container shows growth, the entire batch may be rejected unless it is proven to be due to laboratory error. In short, sterility testing safeguards patient safety and ensures pharmaceutical products are free from harmful microbes. Sterile product equals safe product. Thanks for watching. Do not forget to like and subscribe for more pharma content. Promote Dr. Satish Pulshettiwar YouTube channel.
So let's explore these particular methods. Now, questions come in the mind whenever we talked about sterility testing. Which of the following, which of the pharmaceutical products need to be labeled as sterile? If we just come across the various pharmaceutical products, which products, as I said, those products directly come in contact with the lacrimal fluid and blood, that preparation need to be sterile. So now you can see in this picture the IV solution that is coming into contact with blood, ophthalmic eye drop which is come in contact with lacrimal fluid, injection, vaccines, surgical dressing, and some of the medical devices that all need to be sterile. So that is very important, we can say, and for that we need to ensure the sterility test. So what is this sterilization and sterility? So contamination in sterile product is a serious problem in sterile manufacturing. If we just talked about any kind of product which is directly come in contact with the blood and lacrimal, need to be always manufactured in aseptic area, that is class 100. So in previous video we have been discussed about that. It should be labeled carefully to produce quality products, since product, because these are the products will not pass through digestive system. That's why they called as parenteral, goes to direct to bloodstream. So that may cause, if you just take any contamination products, that may seriously consequences to patients. That is very important. We need to always check the this thing. What is this sterility testing? They are the qualitative test. If we just talked about this, they are the qualitative test. Need to be performed on product gone on sterilization process. Sterilization process we discuss, that is different moisture sterilization, dry sterilization, radiation sterilization, filtration sterilizations. So that process mostly used in order to make the product sterile. And after sterilization, we need to ensure that products are sterile. So for that, we need to perform the sterility test in order to make them free from viable microorganisms. That is very very important. If we just talked about that, because this is the test applied for this product which directly come in contact with bloodstream and lacrimal fluids. And this is the process of validations of sterilization steps. It must be carried out in a strict aseptic area that we discuss in the clean room classification. The different class of class A, class B, class C, class D. So grade A area is also called as class 100 area, which is mostly used in order to manufacture these sterile products. Now, next part, what is objective? We just talked about the objective. What is the objective? So objective is, this test for sterility are intended for detecting presence of viable form of microorganisms and pyrogens, which is endotoxins, mostly produced from gram-negative bacteria in or on pharmaceutical preparation. And this test is applicable or recommended for sterile product like ophthalmic eye drops, injectables, infusion, implant, syringe, surgical dressing, needle, and medical devices, etc. And the major purpose is to ensure and to validate sterilization process. Next, to check the presence of viable microorganisms. Those are viable in the any products in preparation which is labeled as sterile. Need to be always checked. And to prevent the issue of contaminated product in market. Just now we have discussed about why product getting recalled from markets. Product should not recall. So that is the way how we can ensure the sterility test. Okay, a sterilization process also. Moving to the next part, and this test need to be always carried out in the condition designed to avoid accidental contamination of product during the test. If you are manufacturing aseptic area and if you are performing the test in non-aseptic area, probably you will get false results. You will not get that positive results then. So that's why this need to be performed in strict aseptic condition in order to get the proper results. Because then next, what is principle of this test? The principle behind this test is based upon that if microorganisms are present, are placed, for example, In medium is mostly we use fluid thioglycollate medium, and another is soybean-casein digest mediums. So fluid thioglycollate medium is mostly used for supporting anaerobic and some aerobic bacteria. However, soybean-casein digest medium which support fungi and aerobic bacteria, and which are supposed to be incubated for 14 days and observe the turbidity. So this will provide nutrient, because when if you want to check the contamination, that is nothing but the microorganism, any preparation, then we need to provide the nutrients and that and water. And then if microorganism present, then probably what happens, that will give the favorable temperature and conditions, and microbe will grow, and their presence can be further indicated by turbidity in the original clear mediums. If you have medium which is already sterilized and which is clear, and you have sample, say example injectables, and you are pouring that sample into that nutrition media, and if your sample sample means that is subjected for testing, and that sample contains a microorganism, that will certainly grow in that culture media, and that culture media become terbites, and that will indicate the presence of your contamination. So that is a major principle behind this, we can say, this sterility testings. It has to be done by two methods. We'll discuss in my next video, that is membrane filtration method and direct inoculation method. Now in this session only we'll discuss the basic principle and the strategy and how to perform this test. And precaution taken for this purpose should be not adversely affect on any microorganism, which should be revealed in the test. So regular monitoring is very important. And now next part, when to perform sterility test. Now say you're working in any manufacturing units, you're manufacturing this vaccine, for example, which is manufactured in aseptic condition, means is class 100 area, a grade A area. And after that, we need to always sterilize. Mostly we use radiation sterilization, autoclave, moisture sterilization, dry sterilization, filtration sterilization. Again, depending on the product, it varies with the product to products, because that we already discussed in my previous video about sterilizations. The next is, you'll be after this you'll be getting sterile products. So once you get sterile product by using this method that you use, we need to always ensure after that whether the product is getting sterilized properly or not. So for that purpose, we always perform the test that is called as sterility test, and that need to be performed in aseptic condition by two approaches. One is direct inoculation method, and another is membrane filtration methods. So we'll discuss in details in my in the previous video, so we can see all these things. After that, we need to ensure whether the product is sterile or not. The product does not contain any kind of contaminations. Once you interpret it properly, if you just get it done properly, then you'll be getting that results, and from that you'll ensure product is sterile. Then you can label it in your products. This is the way how this sterility need to be performed. And what are the precautions during the test? The first precaution is it should be conducted under aseptic condition, that is class 100 ISO 5 clean room. Then use of laminar airflow cabinets, that is very important. You must have, you can see over here in this video, this person is performing the this particular test in this laminar airflow units, and strict gowning procedure and regular environmental monitoring should be done. You can see the gowning properly. The pharmacist, you can see the person who is performing the test has already wear this all the gowning process. Then positive and negative control must be included. That's very important. In order to get the positive results, in order to get the proper results, we can say it need to be included. So what are steps we have discussed? The first step is need to be, first sample should be collected. It should be mostly done by random sampling process, or as well as finished products. Then selection of methods. We will discuss in details in uh, upcoming videos how this membrane filtration and direct inoculation method can be used, and what is selection criteria of these methods and all that. Then culture media. Just now I told you we use two culture media. One is FTM, that is fluid thioglycollate medium. Another is soybean-casein digest mediums. So this medium should be used. Always you should use positive negative controls. And after that, we should incubate for 7 days, 14 days, and interpret your results. These are mostly, this is the steps involved in sterility testing of pharmaceuticals. In case of membrane filtration, we use 0.45 membrane filters. That is because this product is passed through that membrane filter. Filter is then transferred to two types of media, that is FTM and SCDM. So we will discuss that things. In direct inoculation method, directly the product is inoculated into these two mediums, and further it has to be incubated. That is very important. And acceptance criteria is no visible growth in either media for 14 days. Then we can say test is passed. If growth is detected, perform an investigation, identification of microorganism that could indicate contamination during products are testing. That is very important. We always need to ensure all. Then and then only we can understood this. You can see the results. If your product is remain clear throughout that incubation periods, that is 14 days, then you can say product is sterile. If turbidity found, then again you have to repeat that test and again reconfirm that. Repetition is very important because you have to ensure that sterility in as per the process. Now you can see clear and turbidity. Okay, if sample remain clear, then you can say the sterility passes as per IP. If sample found turbidity, then we can say that your sample does not passes the sterility test as per the official compendiums. So this is the, we can say, interpretation, how we can interpret it. So this is the way how we can see the results. Yeah, we will continue next video how we can interpret it and further we can get it done. So finally I conclude, sterility testing is not just a compliance requirements, but it is life-saving steps to ensuring patient safety. So understanding and performing it with accuracy is must for every pharma professionals. I hope you understood these topics very well. If you are not like this video, please like my video, subscribe it, and always press the bell button so that you'll be getting updated video from my sides. Thank you very much.